It is midnight. The house is completely still. You have been in bed for hours. Your body is tired, genuinely deeply tired, but something is wrong.
Neck aches, your lower back is tight, your hips feel like they've been pressed into concrete. And when the alarm finally goes off in the morning, you open your eyes and think, why do I feel worse than when I went to bed? If that sounds familiar, I want you to listen very carefully to what I am about to tell you. The problem is not your mattress. It is not your pillow. It is not even your age. The real problem is the position your body is spending 7 or 8 hours in every single night. And according to new research from the National Institute on Aging, certain sleeping positions can increase your risk of stroke, memory loss, and chronic pain by more than 60%. 60%. Not from your diet, not from lack of exercise. From the way your body is lying right now while you sleep. Here is what makes this so alarming. Most seniors are doing it every single night, and they have absolutely no idea. But here is the good news. You can fix this tonight, without buying anything new, without changing your bedtime, and without doing anything complicated. Because today, I am going to walk you through the 4 worst sleeping positions that are quietly aging your brain and your body, and then I am going to give you 4 better ones you can start using tonight. Stay with me until the very end, because the last position on our better list, position number 4, is what geriatric sleep specialists are now calling the single most healing posture a senior over 60 can sleep in. And most people have never even heard of it. My friends, I want you to know something important before we begin. If you have been waking up stiff, foggy, or exhausted, that is not simply getting older. That is not just how it is supposed to feel, and I say that with complete confidence. Many people believe that poor sleep is just an inevitable part of aging, that your body needs less rest, or that aches and pains in the morning are just the price you pay for the years you've lived. That is a myth, and it is a dangerous one. Here is the truth. The problem is not your age. The problem is what happens to your spine, your airway, your brain, and your cardiovascular system when your body holds the wrong position for 6 to 8 uninterrupted hours. Think about it this way. If you held your neck twisted to one side for just 30 minutes while you were awake, you would feel it immediately. But when you are asleep, when your body has no way to send you a warning signal, that same unnatural position can persist for hours. Every single night. Your body is not failing you. Your position is failing your body. And the moment you understand that, everything changes. Today, I am going to take you through 8 sleeping positions, 4 that are silently working against you, and 4 that can help your body repair itself while you rest. These are not just comfort suggestions. These positions have been studied by sleep specialists, spine surgeons, cardiologists, and neurologists, and the findings are extraordinary. We will start with the 4 worst, because you need to know what to stop doing before anything else will work. Position number 2 on our worst list is one that nearly half of seniors do every single night, and it is directly linked to accelerated spinal aging, balance loss, and morning brain fog. And our bonus position at the end, the one most people have never tried, may be the most powerful recovery posture your body has access to right now. Let us get into it. Worst position number 4, sleeping on your stomach. It might feel comforting at first. Lying face down, arms tucked beneath your pillow, cheek pressed softly against the sheets. For many older adults, this is the position they have fallen asleep in for decades. It feels familiar. It feels safe. But here is what is actually happening to your body while you sleep this way. When you turn your head to one side, as you must when lying on your stomach, your neck twists into an unnatural angle for hours at a time. This compresses the delicate nerves along your cervical spine and restricts blood flow moving upward toward your brain. Over weeks and months, this leads to chronic neck stiffness, persistent morning headaches, dizziness upon standing, and that familiar tingling in your fingers and hands that many seniors chalk up to just getting older. According to the American Chiropractic Association, stomach sleeping increases the risk of cervical misalignment, a condition directly linked to long-term balance and coordination problems, which are the leading cause of dangerous falls in adults over 60. And it does not stop at the neck. When your chest is pressed into the mattress, your diaphragm, the great dome of muscle responsible for deep breathing, cannot expand fully. Your lungs are compressed. Your breathing becomes shallow. And for someone over 60, whose lung elasticity has already naturally decreased, this means less oxygen reaching your heart and brain throughout the entire night. Take Mr. Harold, a 72-year-old retired carpenter from Ohio. Harold had slept on his stomach his entire adult life. "It feels like my back relaxes," he told his doctor. But after years of waking up with tingling hands, neck pain, and what he described as a foggy head that never really clears, a geriatric specialist reviewed his sleep habits and immediately identified the cause. Harold was, in his own doctor's words, spending every night in the most aging position a spine can be in. Within 3 weeks of changing his position, his morning headaches were gone. Within 2 months, his balance had measurably improved on a standard coordination test. Dr. Emily Rhodes, a geriatric sleep specialist, calls stomach sleeping the most aging position for the spine, explaining that the combination of cervical rotation and chest compression accelerates vertebral wear in a way that mimics decades of additional stress on the body. Do not sleep on your stomach after 60, not even for a few hours. Worst position number 3, the tight fetal curl. Now, sleeping on your side in general is not a bad thing. In fact, as we will see in part 2 of this video, side sleeping done correctly is one of the best things you can do for your body at night. But there is a version of side sleeping that is quietly doing serious damage to thousands of seniors every night, and it is the tight fetal curl. Knees drawn up high toward the chest, body bent in a severe C-shape, arms tucked close. For Mrs. Aliner, a 68-year-old grandmother from Michigan, this was the only way she had ever slept. "It feels safe," she said, "like I am cradling myself." But after years of waking up breathless, increasingly stooped in her posture, and suffering from what she called a back that never fully straightens out in the morning, her doctor uncovered what was really happening. According to the National Sleep Foundation, when the knees are pulled too high toward the chest during sleep, the diaphragm becomes partially compressed. This restricts how fully your lungs can expand, forcing your body into shallow breathing for hours. For older adults whose lung tissue is already naturally less elastic, this chronic oxygen reduction leads to fatigue that no amount of caffeine can fix, morning headaches, and gradual strain on the cardiovascular system. But the spine damage may be even more serious. Holding the body in a severe C-curve for 6 to 8 hours a night shortens the muscles, ligaments, and connective tissue along the back and hips. Over time, this actively worsens spinal curvature. Dr. Leonard Hayes, a spine specialist with over 30 years of clinical experience, puts it plainly. For seniors, sleeping too curled up is like spending the night teaching your body to shrink. The posture you practice while you sleep becomes, over months and years, the posture you carry while you are awake. A tight fetal curl at night becomes a stooped, forward-leaning posture during the day, increasing fall risk and reducing your lung capacity even further. If you are a side sleeper, keep reading, because part 2 will show you the correct version that turns side sleeping into one of the most powerful healing positions available to you. Worst position number 2, flat on your back with no support. For a long time, doctors recommended sleeping flat on your back as the gold standard of healthy sleep posture. Straight spine, even weight distribution, no twisting. It sounds logical, and for younger adults it often is. But for older adults, and this is critical, flat back sleeping without the right support can become one of the most dangerous positions of all. Here is why. When you lie completely flat on your back, gravity causes the soft tissues of your throat, your tongue, your soft palate to relax backward toward your airway. For seniors whose throat muscles have naturally lost some tone with age, this narrowing can become a serious obstruction. The result is snoring and, in many cases, something far more dangerous, obstructive sleep apnea, where breathing actually stops and restarts dozens of times throughout the night. Take Mr. Robert, a 74-year-old veteran from Florida, a disciplined man. He had slept flat on his back, arms at his sides, his whole adult life. But his wife began noticing long pauses in his breathing at night, gasping, choking sounds, mornings where Robert woke up exhausted and disoriented despite a full 8 hours in bed. When he finally saw a sleep specialist, the diagnosis was severe obstructive sleep apnea. His airway was collapsing up to 30 times per hour throughout the night. And the cause? His flat sleeping position was working directly against the anatomy of his aging airway. According to the American Academy of Sleep Medicine, untreated sleep apnea in adults over 60 increases the risk of stroke, heart attack, and memory loss by more than 60%. It silently raises nighttime blood pressure. It prevents your brain from completing the deep, slow-wave sleep cycles during which memories are consolidated and cellular repair occurs. Flat-back sleeping also worsens acid reflux, which affects nearly half of adults over 65. When your head is level with your stomach, gravity cannot keep digestive acid below the esophagus. It creeps upward, burning the throat, disrupting sleep, and in chronic cases, damaging the vocal cords and lung tissue in a condition doctors call silent reflux. The position that once seemed the safest can, without proper support, become a nightly assault on your heart, your brain, and your airway. We will fix this in part 2 with a small, powerful adjustment that changes everything. Before we move to our final worst position and then dive into the 4 better ones, I want to take a moment to ask you something. If this video is helping you understand what has been happening to your body at night, if you are already thinking about changes you want to make tonight, please take just 1 second and click the like button on this video. That single click tells YouTube that this information is helping people, and it helps us reach more seniors who are waking up every morning in pain and wondering why. You might be the reason this video finds someone who truly needs it. And if you have not subscribed yet, please do. Every single week, we break down real science-backed health information specifically for adults over 60. No fluff, no filler, just the truth about what your body needs as it changes. Join our community. We are glad you are here. Now, let us talk about the worst sleeping position of all. Worst position number 1, sleeping in a recliner chair. Many seniors discover the recliner by accident. The bed starts feeling uncomfortable. The back aches when lying flat. Acid reflux wakes them up. And somewhere along the way, the recliner starts to feel like the answer. It is angled, supportive, and it keeps the head elevated. For a night or two, it may even help. But over time, and this is the part most doctors do not warn their patients about clearly enough, sleeping habitually in a recliner becomes one of the most quietly destructive sleep habits an older adult can develop. For Dorothy, a 70-year-old retired librarian from Georgia, the recliner had become her bedroom. She spent her nights partially reclined, feet elevated, television flickering in the background. "It is just easier," she said. "The bed hurts my back." But after nearly a year of recliner sleeping, Dorothy noticed something frightening. She was becoming weaker in her core. Her posture was deteriorating. She was falling asleep but waking up feeling like she had barely rested at all. She was losing her independence, one night at a time. Here is what recliner sleeping does to the aging body. The partially upright angle prevents your spine from fully decompressing. Unlike a proper lying position, where gravity is distributed evenly along the full length of your vertebrae, a recliner keeps the lumbar spine in a state of semi-flexion for hours, quietly accelerating muscle weakening in the hips and abdomen. These are the very muscles responsible for balance and upright movement. Even more critically, recliner sleeping prevents your body from reaching and sustaining the deep sleep stages it needs for cellular repair, immune function, and memory consolidation. Your brain cannot complete its nightly cleaning cycle a process researchers call glymphatic drainage, in which cerebrospinal fluid flushes metabolic waste from brain tissue in a partially upright position. Studies now directly link disrupted glymphatic activity with accelerated cognitive decline and an increased risk of Alzheimer's disease. Dorothy's doctor eventually told her something that stopped her cold. You are resting, but you are not recovering, and over time, those are not the same thing. She returned to her bed that night with a new understanding of exactly how to position her body, and that brings us to everything you have been waiting for. Better position number 4, the supported side sleep with a pillow between the knees. This is the corrected version of side sleeping, and for most seniors, it is the single most accessible improvement they can make tonight without purchasing anything new. The adjustment is simple. Lie on your side. Place a soft pillow between your knees. Make sure your head is supported so that your neck remains aligned with your spine, not drooping downward, not angled upward. That is it. But what that small pillow does for your body is extraordinary. Take Mr. Allen, a 71-year-old retired firefighter from North Carolina. For years, Allen woke up every morning with a deep, dull ache in his lower back and hips. He had tried mattress toppers, pain relievers, and stretching routines. Nothing lasted. During a routine checkup, his physical therapist asked him one question: "How do you sleep?" Allen described his habit: on his side, knees pressed together, body slightly twisted. She handed him a small, firm pillow and gave him one instruction. He tried it that night. Within 2 weeks, his pain had decreased by nearly half. "It is like my body finally exhaled," he said. According to research from the Cleveland Clinic, side sleeping, particularly on the left side, promotes superior blood flow to the heart, reduces acid reflux by keeping the stomach positioned below the esophagus, and supports the lymphatic system's natural drainage function. The pillow between the knees accomplishes something crucial. It keeps the pelvis balanced and level, which eliminates the rotational pull on the lower spine that causes the hip and back pain so many seniors experience every single morning. Left side is best when possible. Research consistently shows that left side sleeping improves cardiac circulation, reduces nighttime acid reflux, and supports the body's natural glymphatic cleaning process. If left side sleeping causes shoulder discomfort, right side is still far superior to stomach or unsupported flat back positions. Doctors call this position the alignment saver, and for good reason. Better position number 2, flat on your back, head and knees slightly elevated. Remember Mr. Robert, our veteran whose flat back sleeping was fueling his sleep apnea. Here is the solution that transformed his nights. The fix for flat back sleeping is not to abandon it entirely. It is to elevate it correctly. Place a wedge pillow or a folded firm pillow beneath your head and upper chest, raising your upper body by approximately 20 to 30 degrees. Then place a second pillow beneath your knees, creating a gentle bend. This is what sleep physicians call the elevated back sleeper position, and for seniors managing acid reflux, sleep apnea, arthritis, or heart conditions, it is one of the most therapeutically powerful positions available. For Mrs. Linda, a 73-year-old retired teacher from California, this change was life-altering. Linda had suffered from nighttime heartburn and shortness of breath for years. Her cardiologist, Dr. Raymond Cho, suggested this exact adjustment. Within days, Linda reported breathing more easily, sleeping through the night, and waking without the burning sensation in her throat that had plagued her for years. "It's not about sleeping longer," Dr. Cho told her. "It is about sleeping smarter." By giving your body the right angles, you give your heart and your lungs room to function freely, even while you dream. Elevating the head and chest uses gravity to keep stomach acid below the esophagus, preventing reflux. It also prevents the soft tissues of the throat from collapsing backward into the airway, reducing snoring and sleep apnea episodes significantly. According to the American Academy of Sleep Medicine, Seniors who sleep with their upper body slightly elevated experience measurably fewer nighttime oxygen drops, the kind that silently strain the heart and damage brain cells during what should be the body's most restorative hours. The knee pillow completes the picture. It gently tilts the pelvis, relieving the compression on your lumbar spine that makes flat sleeping uncomfortable for so many older adults. Better position number 3, the starfish, back sleeping with arms gently out. There is something profoundly releasing about this position. Lying on your back, arms resting gently out to your sides, palms open toward the ceiling. It is a posture of complete surrender, and for your body, that surrender is deeply healing. The starfish position distributes your body weight across the widest possible surface area. This means no single joint, pressure point, or muscle group is bearing concentrated load through the night. For seniors managing arthritis, fibromyalgia, osteoporosis, or general joint inflammation, this even weight distribution can mean the difference between waking up stiff and in pain versus waking up with genuine mobility. With the arms resting away from the body, not pinned beneath the head or pressed across the chest, your shoulder joints decompress naturally. Circulation to the arms remains unrestricted, eliminating the numbness and tingling that many seniors experience when their arm position cuts off blood flow during sleep. Pair this position with the slight elevation we discussed in position 2, a gentle raise beneath the head and knees, and you have one of the most joint-protective, circulation-friendly, airway-open postures available. Research published in the journal Sleep Medicine Reviews confirms that supine positions with proper elevation support superior cardiac output during sleep, meaning your heart works more efficiently and pumps blood more effectively to your brain and extremities throughout the night. For seniors who have been told they are too uncomfortable for back sleeping, this is the version to try. Arms out, head slightly raised, knees gently supported, body open. Better position number 1, the 45-degree side recline. And here it is, the position that geriatric sleep specialists are now describing as the single most restorative sleep posture for adults over 60. Imagine lying on your side, but instead of being completely horizontal, your upper body is supported at approximately a 45-degree angle by a firm wedge pillow or a body pillow behind your back. Your lower body remains comfortably horizontal. A small pillow is placed between your knees to maintain pelvic alignment. Another pillow keeps your head and neck in a neutral line with your spine. You are not lying flat. You are not sitting up. You are in the precise middle, and that is where the extraordinary healing happens. For Mr. Walter, a 78-year-old former truck driver from North Carolina, this position was the answer he had spent decades looking for. Walter had battled back pain, acid reflux, and shortness of breath at night for years. New mattresses, medications, even recliner sleeping, nothing worked. Then his physical therapist, Dr. Renee Collins, guided him into the 45-degree side recline, a firm wedge behind his back, a pillow between his knees, head supported in line with his spine. The first night he noticed the difference immediately. No gasping, no heartburn, no hip pain. Within 1 week, his sleep tracker showed longer periods of deep, slow-wave sleep. For the first time in years, he said, I woke up clear-headed, like my brain had actually rested. Here is the science behind why this position is so powerful. According to research from the Journal of Geriatric Sleep Studies, the 45-degree lateral recline reduces acid reflux episodes by up to 70%. Because the angle of elevation keeps stomach acid below the esophagus, while the side position keeps the stomach below the esophageal junction. It keeps the airway open, reducing sleep apnea and snoring. It supports spinal alignment, critical for those living with arthritis or osteoporosis, because the wedge removes gravitational stress from the lumbar region, while the side position prevents the cervical compression of stomach sleeping. But perhaps most remarkably, this position maximizes the brain's glymphatic drainage system, the nightly process by which your brain literally flushes out metabolic waste products. including the amyloid plaques associated with Alzheimer's disease. A landmark 2019 study found that lateral sleep positions enhance this drainage process more effectively than any other posture, and that the gentle incline of a 45-degree angle optimizes cerebrospinal fluid flow during the night. Dr. Collins tells her senior patients, sleep is not just rest, it is recovery, and your body heals best when it is supported, not strained. Before we wrap up, I have one bonus tip that will multiply the power of any sleep position you choose tonight. It is called the 2-minute wind-down breath. Regardless of which position you settle into tonight, spend just 2 minutes doing this before you close your eyes. Breathe in slowly through your nose for a count of 4. Hold for a count of 4. Exhale slowly through your mouth for a count of 8. The extended exhale is critical. It activates your parasympathetic nervous system, lowering your cortisol levels, reducing your heart rate, and signaling to your brain that it is truly safe to enter deep sleep. A 2021 study published in Frontiers in Human Neuroscience found that just 5 minutes of slow, extended exhale breathing before sleep increased slow-wave sleep duration by an average of 37% in adults over 60. That is the deep, restorative sleep where your body repairs tissue, consolidates memory, and resets your immune system. 2 minutes every night. It costs you nothing, and it makes everything else work better. My friends, everything we have covered today is grounded in real, peer-reviewed science, not guesswork, not trends. A study from the National Institute on Aging confirmed that certain sleep positions elevate the risk of stroke and cognitive decline by more than 60% in older adults. Researchers at the Cleveland Clinic found that lateral sleep positions with knee support measurably reduced lumbar pain and improved cardiac output in seniors over 65. A landmark 2019 study published in the Journal of Neuroscience demonstrated that lateral, specifically left lateral, sleeping positions optimize the brain's glymphatic drainage system, most effectively removing the amyloid plaques linked to Alzheimer's disease. The Journal of Geriatric Sleep Studies documented a 70% reduction in acid reflux episodes among older adults who adopted the inclined lateral position. And the American